Hello, everyone, and welcome to our webinar, Managing Nurse Onboarding with AI Data Integration, featuring UNC REX Healthcare. Currently, everyone is automatically muted, but if you have any questions, you can type them into the question box, and we can answer them during the Q&A at the end. My name is Tom DeSantis from Laudio. We're healthcare's first transformational leadership platform. Our mission is to transform frontline managers, and specifically for today's call, nurse managers, into exceptional leaders. And we do that with artificial intelligence and data analytics. I know many of you on the call today have already been introduced to Laudio and have joined us to hear how our client UNC REX Healthcare is maximizing our technology. So I hope this presentation focused on one of their specific use cases is something from which you can learn as you think about how Laudio can work for your teams. And for everyone else who's new to Laudio, welcome. For our agenda, I'm going to begin by introducing our special guest. I will give the briefest overview of Laudio to provide some context. I'll talk about how we've worked together to build the onboarding functionality. Katie will walk through UNC REX's onboarding initiative, and we will conclude with a Q&A. I've planned for no more than 30 minutes of your time, so I thank you all for joining. It's my pleasure at this time to introduce Katie Pollara. Katie is the Manager of Workforce Development and Strategy for UNC REX Healthcare. Her background is employee relations and human resources, and I know we have several folks from the HR side on the call, so I know she's in good company. Specifically at UNC REX, she works on the strategy side in regards to workforce development and retention for nursing. More importantly for today, she is the project lead for Laudio, and she works directly with their CNO for the implementation of the platform across nursing. Welcome, Katie.
Thank you, Tom. Glad to be here.
Thank you. So speaking of the platform, here's the 30,000-foot view of Laudio from a manager's perspective. Basically, it's their one-stop tool to manage their teams on a daily basis. We can agree that the expanding demands on nurse managers and the growth in numbers of direct reports, with that, finding the time and the energy to build and sustain engagement is becoming nearly impossible. That's where artificial intelligence and technology can transform this entire process. Here you can see where a manager has delivered insights on individual team members. They're prioritized by need or by risk in this area. You can see where they can act upon this intelligence either electronically or in person, and you can go in by different categories. And then they can document and track their engagement so they can measure the results. All right, without getting too deep, this is the research-based framework we call CARE. So all of the insights we analyze from the HIRS and the time and attendance data, they fall into these most compelling 4 categories. Celebration and recognition, which many of us operationalize either formally or informally. Accountability, for example, who's consistently late or missing shifts. Risk of burnout. We hear a lot about burnout in the news right now for physicians, but for nursing, it's equally as important, or detrimental, actually. Things like who's working too many hours or who is floating too much. And then employee development, which is what we're going to hone in on today. So here's a quote that we live by. We at Laudio, we believe that there's a symphony of all these points of engagement. When they're systematized in a best practice model and standardized equitably across the health system, it can change the game for satisfaction, for retention, and ultimately for quality of care. And of course, we're here today to learn about how data integration and the touch points and the engagements can impact onboarding. So without further delay, I'd like to welcome Katie Pollara, who's going to share the UNC REX onboarding model and how they are using Laudio to really take advantage of the technology that's available that optimizes this entire process. So take it away, Katie.
All right, thank you. Well, thank you guys for having me again. What we wanted to share today is a new hire onboarding program that we put together this year, and you can move to the next slide if you'd like to. And all of this was driven based off of our strategic goals and just needs within nursing. So this is just sort of a little quick background. Underneath the Transform Ourselves goal there, we have one objective that's specific to inspiring a caring environment for one another. And so one way that we are working on this is through an initiative we've called Caring Culture. And through that, we decided that we needed to really focus on retention and onboarding. And I think we've seen that this is, a focus area for lots of different organizations. And for us at REX, one way that we felt like we could care for our coworkers was through enhancing our onboarding program. So through this initiative, we decided that we needed to focus on folks with less than a year of service. We knew that our turnover was a little higher in that area. and we wanted to focus it on key positions, and we're developing a pilot-type program that we would be able to potentially move forward in other areas. So the focus areas we had, we knew we wanted to include some sort of stay interview in this. A 30, 60, 90-day check-in was going to be important for us. And we needed to have a group of folks that we knew that we could work with, we could measure data, we could control a little better. That was also a key position. And so we decided to move forward with nursing. We felt like we had good data and could measure the outcomes of that, and great support from our CNO. So along with that, just why we decided to focus on the onboarding portion of this, we know the national average for nurses turnover in that first year of employment is about 28%, and it just seems to be drifting just a teeny bit higher throughout the last couple of years. And looking at our own turnover, and this is an average over a couple of years, we knew that we were not too far off of that, and that number was higher than we wanted it to be. So we decided that first year of hire was a group that we felt like we could really target those new hires and hopefully head off. As you look into the 2-year mark, almost 50% of folks are leaving within that time frame. And so we really wanted to make sure that we were able to come up with a program that would target those folks and hopefully prevent them from leaving after that first year and even into the second year.
Katie, before I advance the slide, so we use the NSI statistics as well, and we also do some of our own retention research, and we found a lot of variation across the board, right? And we know it can vary between hospital types. For example, you're an academic medical center versus a community hospital, rural versus urban, all of those factors. And even within a facility, we know certain types of units have a higher retention than others, whether it be the ICU versus med-surg. And we try and, in our platform, we try and, manage that and account for that. But I'm wondering, do you find this to be true in your experience and what you're dealing with?
Yes, absolutely. So there are most definitely some units that have much lower turnover, even if minimal, of folks within that first year, and then others that have much higher turnover. And even when I ran, we say about 25%, like I said, that's an average over the last couple of years. When I looked at this last year's fiscal year's numbers, we actually were below 20%. But that doesn't mean that, our problem is solved.
Yeah,
so we really are focusing on that all the way around. And just the fact that is higher than our overall turnover is where we're looking at. Mm-hmm.
And everyone on the call will agree. I mean, losing one or two, that's still an incredible expense, right, for replacement. So.
Yeah, absolutely. Well, totally part of actually. Yeah, and what we did with this program, a couple of those managers that have very minimal, turnover in the first year, we actually included them on our project team.
Oh, great.
And that was a great resource for us as well.
Awesome. All right, continue. Sorry to interrupt.
No, that's perfect. So actually that goes in very well to the fact of, as we were building this project team, we needed to have a group of folks that we felt like were well represented across the organization. And looking at our nursing turnover, actually a couple of the inpatient nursing unit managers that we included on our team, like I said, did have very low turnover of their folks in the first year. So we knew they were doing something right? We also included our respiratory care. We had inpatient rehab. We have a couple of long-term care facilities here. And so we wanted to include them. We know their turnover oftentimes can be a little bit higher in those areas. Learning and organizational development. As I mentioned before, this project team actually rolled up underneath a strategic initiative for us. And so we were sure to get feedback from other folks that sat on that larger team, so patient experience, senior leaders that worked in our patient care, system leaders within human resources, support services, lots of different angles. We tried to get folks to take a look at this and make sure we were on the right track, and they appreciated the feedback. And part of that was to make sure that it was something that was operational and that this program would be effective, so that we were able to roll out a program that potentially would work here within nursing and then be able to expand to REX and then maybe outside of REX within our system, depending on how all of that went. And also, we, of course, had a focus on internal and external best practices. So we wanted to look at what we're doing well here and then externally. As we were doing our research with this project team, we really looked at, like I said, internal best practices as well as external practices. And when we were looking at these, this concept of check-in meetings kept coming up. And we really felt like this was a great way to help build connections and provide us an opportunity to assess concerns related to any issues that folks may be having within that first year. So, you know, the high points that we found were a 30, 60, 90-day check-in meeting was going to be pivotal in assessing, you know, where our new hires are at and how they're doing. There is the skip level meeting, which is where a staff nurse would meet with a director or someone, you know, at that higher level. And that's a great way for them to build trust and learn a little bit more about the larger leadership perspective and goals of the organization. Career coaching, this is helping folks figure out, you know, what are those career goals and how are we going to help them get there. And we know it's particularly important for our millennials right now. They hit the ground and want to know what the next step is. So we want to make sure that we are having those conversations with them and they feel like this is the right place for them to be able to do that. And then, of course, stay interviews. So making sure we're able to make connections and have great conversations, meaningful feedback with people so we're able to retain those top performers and reinforce that REX is where they'd like to be. As we're looking at these check-in meetings, really these were sort of the focuses that we wanted to make sure, you know, as we built in this series of check-in meetings, we were able to set questions, have opportunities to help build these connections, address any concerns that might be going on. They help retain and engage, really recognizing performance. Our managers, you know, they're able to sit down and talk with folks, have that time to actually meet with people outside of just a 90-day evaluation. And then it builds confidence. It builds confidence in the leadership, the relationship that our employees have with their leader, and then honestly their confidence in their ability to do their job. And am I right on track, you know, setting those expectations and things like that.
Katie, I'm going to interrupt again. So like nurse residency programs, onboarding programs, they're pretty fresh, but they're not all new to all systems. And so for you, with the check-ins, I know you talked about best practices and how you built this. I mean, were check-ins something that you had formalized or people were doing, or did some of the better performers, did they bring them to the table, like to build a program? What were you doing previously?
Sure. Yeah, well, so part of our goal in doing this, with that project team, we did bring in some of those managers that had great processes in place. We had some that were meeting with folks regularly and asking them questions, you know, how's it going? What's going well? What's not going well? What are you really proud of? You know, questions like that gave meaningful conversations and connections that those new hires were building with their managers. We also, however, found, you know, some managers obviously are doing this better than others. We didn't have necessarily a set process for our managers outside of a 90-day evaluation and an annual evaluation. Our educators do regularly meet with our new hires, and our managers do too. But again, these are things that may happen, you know, more consistently on one unit than another. And so we really, our goal with this was to put a consistent process in place, something that we knew would be really structured and something that we could roll out across the board.
Excellent. And the ambulance was a nice touch. Thank you.
I know. I'm sorry. I do work at a hospital, right?
Every time I do a call with someone at a hospital, not a problem. All right, continue.
Right. So all of that research that we did, looking at our internal best practices, those managers that were doing it really well, and then looking at the external, really we felt like the best way to move forward was to set up a series of check-in meetings with our new hires. And through that process, we decided we really wanted to have a touch point with our managers. We know managers are so important in the relationship building and the turnover within that first year. So we made sure that the manager had touch points. We also included a team leader in those touch points as well, because they are part of our leadership structure on our team. We wanted to find a way to work in that skip a level concept, and so we were able to work in our directors, and then our chief nursing officer also is participating in this new hire new onboarding program. So that was a great thing. And then, of course, we did design specific questions for each touch point. So every touch point that we have has questions that are really tailored to where the person may be at that 30th day, that 60th day, that 90th day, and asking questions related to that.
You know, when we were putting this together, Katie, I think I told you, I found it really compelling that you had not just the manager, but multiple people in the ladder there that are interacting with these new nurses. And so I have CNOs on the call today. I have nurse managers on the call. What's, you know, even if it's anecdotally, what's the impact you think having the CNO be part of this process has on those new nurses?
Yeah, absolutely. I think that it's great, and it makes, I think as folks come into the workforce, it's nice to know that their leadership cares. And not everyone's able to put the time to do that. The way that we are structuring it is for Joel to have a conversation, like sort of a breakfast meeting with folks who are hired within the year. And we may do that a few times in the year to sort of capture that subsection of people. But it's really nice. They feel like they have a direct line to leadership and have a better understanding of the overall purpose and the strategy and the reason for the organization.
Yeah,
nice. So I think it's a great time.
If other folks on the call are doing that too, congratulations. But I think that's special. So kudos.
Thank you. We could not do this without his support. It's very, very good to have that strong support in that position.
Agreed.
So this is an overview of the check-in meeting type questions. We did decide on a 30, 60, 90-day specific questions, and those were really targeted to look at the expectations. Is the position what the person thought it would be when they decided to join REX? Work environment really focuses on, is our culture and our workforce, are we being supportive? Are they feeling like their coworkers are helpful? Any challenges or frustrations, improvements that we specifically could make to our onboarding process? Is there any training that we need to work on? Any gaps in that process? And then overall concerns. I can tell you our team spent so many meetings really digging into this 30, 60, 90 day, making sure that we felt like the questions were tailored in a way that our managers would feel comfortable asking them. Were they asking the right questions? We really leveraged, like I said, what our current managers are doing, and then those best practices externally too. So the next steps were a 6-month, a 9-month, and a 12-month check-in, and we actually leveraged resources that our system HR department had created for check-in meetings as well. So they had actually already created a state interview guide for leaders to use, as well as one-on-one. And these questions are all tailored to be generic enough, I guess I would say, within that new hire process that they really could be used for positions outside of just nursing, right? So we are piloting in nursing, but they could be used at any different role within the organization. I was talking to somebody in a different department yesterday, actually, and she's going to use our guides and just start trying to see if it works with her department. So we really did leverage tools that they had already created, and the state interview guide is really a little more broad. It's checking on like what excites someone about being at work, what are they energized by, what makes it a great day, and then for the one-on-one, it's really more about, are they enjoying their role, any barriers, kind of getting a little more deeper into that. So we wanted to make sure that we were incorporating those guides along with the tools that our team developed. This is just a way to lay out sort of how that process came about. This is our timeline, and within this, we have a 30-day meeting with the manager specifically. And we felt like that was very important. The manager made that first contact. Of course, they're meeting with folks within their first day on site, within that first week of orientation, that this really is giving them a true opportunity to sit down and talk to their coworker at that 30-day mark and say, I can't believe you've been here 30 days. How is it going? And ask those questions that we had developed for them. 60-day is a manager or a team leader. Some folks, that might be your assistant manager or supervisor. And they really are a true, part of our leadership team. and wanted to give them the opportunity. Plus, honestly, we knew as we were rolling out this program that this is new and it's different, and we're asking our leaders to spend more time talking to folks, maybe in a more structured way than they had done in the past. And we wanted to find a way to incorporate other leaders to help them with that and to sort of take a little bit of that burden off. And so team leaders are assisting them with that. At our 90-day, we have the directors. Actually, some of our directors have already done this. They jumped the gun on our pilot project and went ahead and started meeting with their new hires, and have gotten some great feedback from folks who just, were really appreciative of the opportunity to sit down. Most of them are doing like a breakfast or a little snack break in the afternoon and inviting folks in and asking them a few questions about how it's going. And then it also gives these folks an opportunity as new hires to make connections with other coworkers who are in a similar position, right? They're also new to the organization. So we found that to be a great addition to this program. And then our managers already have a 90-day review that they have to do with our new hires. And we just added on a couple of questions, a little more career-focused and next step-oriented related to goals for them to ask, and kind of make that a more meaningful conversation other than, are you doing everything, all of your job duties are being checked off, At 6 months, it is a manager or a team leader. 9 months, the same thing, manager or a team leader. And then at that 12 month, we are using our state interview guide, as we mentioned, and the manager will meet with them, congratulate them on finishing that first year, and then our chief nursing officer will also have a larger breakfast meeting with folks. This is the longer timeline, and I mentioned that we wanted to make sure we were sort of sharing the love in these meetings with our managers and our team leaders. We also had some conversation on including educators, because we know our educators are also having meetings with our new hires, regular check-ins with preceptors as well, and decided right now that we would not incorporate them into this, but that was a consideration with it. So far, we've had great feedback on the manager or the team leader as well. And we knew our managers are used to having conversations with folks about, how are things going? What are the next steps for you? Asking those types of questions, but our team leaders don't always have those type of conversations with folks. And so we were very aware as we were rolling this out that we were giving them the education that they needed in order to make this a successful process and make sure that they are comfortable having those conversations. This is just a quick snapshot of what our infographics look like. So we have infographics that have been set up for each of these checkpoints. It includes the questions that should be asked, kind of why we're doing this, and it's a one-pager that the leaders can easily print out and use. We did our education session, so we educated our managers as well as our team leaders on this process. And like I said, also gave them some really good training along with our system LOD folks on how to have coaching conversations. What does this look like? How to set the tone and ensure that it's a good, meaningful conversation, and make sure that we put all of these things online so it was able to easily access this. Our implementation and rollout, we began this pilot starting 2019, so anyone who was hired in this year we're doing. We did our education and training, talked a little bit about our tools and resources. With our checks and balances, we have asked our managers to, as they are having these meetings, roll that information back to their directors, and that way it's helping us take a look at trends. Laudio also has some nice functionality in there where we can see who's actually going in and checking and having these meetings, so that is helpful. And then, of course, as a last step, integrated this with Laudio. So it has been a great way for us to move forward. We were very excited. As we took on this program, we knew we were asking folks to track different new hires at 6 different points in their first year, and how are we going to do that? And Laudio really helped us with that. Tim and Riddle on the team were fabulous. And the system actually, this is a view of what it looks like. We'll remind people, you have someone who has a 1-year check-in, do a 6-month, a 30-day, and then our managers can go and just click on asking questions, and then this shows you the questions that are underneath, so that's really helpful. And then if you move to the next slide, you can see that they actually can add the information in on the coworker, so they can just go ahead and type in when they have the meeting or after they have the meeting. If they want to log how that went, they can capture the information right there.
Excellent. Hey, Katie, so someone asked a question regarding when they use this. So a lot of what we're talking about seems like it's in person and very high touch. And then some of it, we're talking about technology and AI and such. What are you finding in the short time that you've been doing it? Is there a mix? Are some people doing it all online? Are they going to find people on the floor and then documenting it? What are you finding?
Absolutely. So I would say it's a mix. I have some managers who have will sit down, have the conversation with the person, and then type it in real quickly right after. I've actually seen a lot of them will even print out the questions that are written there, and they take handwritten notes, and then they just hold that for themselves. They also could take a picture of it and upload it into Laudio, so it would be there next time they meet with their coworker. And then we have our float pool and our manager with that group. You know, she doesn't really see her folks all that often. They could be here, you know, once every couple of weeks, and she may not be working that day. So she actually has used this, and you can send an email directly from the system to the person, and it includes the questions. So she does it that way, and it works really well for her, and is great because everything's automatically in the system.
That's nice that you allow for, you know, flexibility, because every manager has their own style, but as long as they're following a format and standardized.
Yeah, and we know that they are just everyone's stretched for time. There's too much to get done, and so however they're able to do it, we are glad that they are making the time to meet with these folks. And we have these questions that are identified that even if they just get through a couple of them, you know, as they run into someone on a unit, I think that's a win. So absolutely.
Excellent. And then I'm kind of concluding with just another snapshot. I pulled out some of the other, you know, benefits that go beyond on the care framework. They go beyond just the, you know, the E, it's the C, the A, and the R. Giving these insights, reminding people what to do, showing people who needs attention, who needs the engagement, whether it's to applaud them, you know, and celebrate them, or whether if it's to kind of intervene and make sure that they're getting the support that they need. So for those of you that have seen a demo, great. This is just another feature that we're showing today. For those of you that are new, that haven't seen us, we're more than happy to get you deeper into the platform at some point at your convenience. But that actually concludes the formal presentation, and that takes us down to the half-hour mark. Katie, I want to thank you so much for you know, sharing this and letting people know what UNC REX is doing. And I know it's early stages, but what are you hearing from the field? What's the impact, or what's the reaction so far?
Yeah, you know, we've actually gotten really good feedback so far from our managers who have sat down and talked to folks, and the ones who have decided to do this via email. I was actually talking with a manager this week, and she did a 9-month check-in. So she's ahead of the game, and did a 9-month check-in with one of her new grads who she wouldn't normally have talked to specifically, and asked those questions. And through that conversation was able to find out that she was really interested in nurse retention. And so now we've been able to put her on our retention team as well. So I think there's a lot of good information and connections that are being built through this program. We're excited about it.
Yeah, we are too, and we're glad to be working with you. Another question. What are you tracking? So you just talked about retention. So I'd imagine looking at those numbers trending would be one. Are there any other sort of metrics or KPIs that you're looking at related to Laudio specifically and the onboarding?
Yeah, so we are tracking our turnover for folks that are going to be hired this year, and that's going to be one of our main metrics, looking at the previous year compared to this year. And like I said, I have historical data too, so sort of trending that and seeing what it looks like. I would even like to take it out to the 2-year mark, as well as the folks at Laudio have been really great and been able to provide me sort of numbers on who has gone into this from a manager perspective. So that end user, the manager is the one that would be using the system, and so we're able to track sort of who's actually using it, who is going in and doing these check-in meetings and making notes on folks, and keep capturing that data. So we are looking at that as well and sharing that with folks too.
Excellent. And then the final question was, someone wants to know if this would be available, and yeah, we'll reach out to people individually. So with that, Katie, thank you so much again for joining us today, and for everybody on the call. We really appreciate your attention and hope you learned what you expected to learn. And Katie, I'm sure we will have you back at some point to kind of update us on how it's going and once this is fully rolled out. And we, again, keep your support and your partnership. We appreciate it.
Absolutely. Thank you for having me. I'm glad to take any questions. So thank you.
All right. Have a great day, everyone.